Member Saanich North and the Islands. And
thank you, Mr. Speaker.
Leader.
Thank you, Mr. Speaker. As we noted yesterday, the government spends $1.3 billion contracting long-term care to for-profit companies and not-for-profit societies. 93% of the sector's revenues are funded through BC taxpayers. Given the magnitude of the public expenditure and the vulnerability of the population served, it's reasonable to ask whether sufficient financial oversight is in place to ensure that BC seniors are receiving the best possible care for the money that we've invested. Unfortunately, the answer seems to be no. Contracted care homes are required to provide their health authority with annual audited financial statements. These statements are available to the public if the care home is operated by a not-for-profit society. But for-profit operators are not obliged to make their audited financial statements available to the public. Considering that for-profit companies are already not delivering hundreds of thousands of hours of care that they are publicly funded to provide, my question through you, Honourable Speaker, is to the Minister of Health. Why are we not requiring significantly more disclosure from for-profit care home operators, especially considering significant public resources are going into these facilities?
Minister of Health.
Well, thank you very much, Honourable Speaker. The member will know that historically in the past, the healthcare system, the long-term care system, was a more direct system. It was there were independent long-term care contractors, but everyone operated under the same collective agreement, and there weren't any subcontractors. Over the past couple of decades, that changed, and we mostly have a system, a contracted system that includes a very significant for-profit private sector, nonprofit private sector, and importantly, subcontractors. This was the situation in 2017-18 reflected in the report that he refers to from Ms. Will McKenzie, the seniors advocate in BC. So what have we done? We've increased the standard of care for everybody in the system by increasing the care hours for all residents. And this is important. And put behind that auditing measures that support it. And those are very significant changes because they improved the quality of care. Currently, the accountability the member talks to comes in through data spreadsheets, and that old-fashioned methodology makes the accountability he wishes more difficult. I agree. And that's why we're moving to a web-based tool that allows broader information so we can find the very information required to ensure that the money taxpayers spend goes for the care that residents deserve. And that's what we're doing. In addition, in the coming year, we'll be reviewing contracting and the contracting system with our partners in the sector with the goal of making things better for residents. So there needs to be more accountability, I agree, and there will be. The Seniors Advocate report reflects the situation in 2017-18, and we are working together with all of the partners in long-term care to improve accountability for residents, to improve the accountability of care, but also increase care standards. And that's what we've done. And that has served us well in British Columbia as compared to other jurisdictions in North America in the last few weeks.
Leader, third party on a supplemental.
Yeah, thank you, Mr. Speaker. And I'd like to thank the Minister of Health for the detailed answer, straightforward answer. We've seen through the, as he noted, the BC Seniors Advocate, Isabel McKenzie, has a detailed report, and in that report it highlights how the accountability mechanisms and transparency mechanisms are different by contract, by operator, by health authority. It seems like there is, as I think as the Minister acknowledged, a wide variety of different mechanisms in place, making it very, very difficult to be able to get a really good understanding of how $1.3 billion is being spent, $1.3 billion of taxpayers' money is being spent. And so I appreciate the Minister acknowledging that, that there will be greater accountability measures being put in place. Can the Minister please let British Columbians know and let us know here through you, Mr. Speaker, when British Columbians can expect those accountability measures to be in place?
Minister of Health.
Thank you very much, Honorable Speaker. And I think you see it now. You see it in the application of the 3.36 monies, which have been supported by all parties in the legislature. You see it in the restoration of the rights of workers in Bill 47. You see it in the change in accountability models. You see it in the money that's being provided to ensure that workers' wages are leveled up during this period when people are under provincial health orders. It's called the single site order, to ensure that workers get the money that's being provided to ensure that their wages are leveled up. And all of these other changes are important. And you see it in the daily hard work of medical health officers who do the work at long-term care homes everywhere in BC, working for health authorities and working with care providers to ensure the quality of care is high. And when it's not, as was the case at Comox Seniors Village, as in the case of Nanaimo Seniors Village, as is in the case of Self-Care Care in Victoria, as in the case in Summerland, with the support of members of all sides of the House, medical health officers and health authority boards, and myself, intervene to ensure the quality of care is protected. It is important to all of us. It is what we owe to people, to residents in long-term care, and it's what we'll continue to work to improve, working with all the partners in long-term care in the coming weeks and months.